Women diagnosed with estrogen receptor-positive early-stage breast cancer have the most favorable prognosis. Unfortunately, many women will experience a cancer recurrence. Of these recurrences, more than 50% occur 5 years after the initial diagnosis. Starting extended hormone therapy after the 5th year of treatment has been shown to reduce the risk of future recurrence. However, the primary clinical studies evaluating the issue show this treatment only benefits 1 out of every 22 to 39 patients treated. Potential risks of extended hormone therapy are already known and documented in medical journals. These risks include increased risk of endometrial cancer, such as adenocarcinoma or uterine sarcoma, increased risk of venous thromboembolism, coronary artery disease, and osteoporosis. The patient may also experience negative side effects, such as sexual dysfunction, hot flashes, joint and muscle pain. For every 500 women with breast cancer that is estrogen receptor positive, extended hormone therapy can reduce only 13 of those distant recurrences. This treatment may also produce 6 severe complications and may even increase the risk of death. About 50% of women treated with extended hormone therapy will suffer from negative side effects that will impact their daily lives. There is an imminent need to identify these low-risk patients. Until recently, there was not a validated test that could provide physicians and their patients this type of information in clinical practice. The Prosigna breast cancer prognostic gene signature assay uses the PAM50 molecular classifier to translate tumor biology into your patient's individualized prognostic score. It identifies the likelihood the cancer will return to any part of the body for 10 years after diagnosis. It is this unique genetic signature that makes it possible to identify the intrinsic molecular subtype. Luminal A, luminal B, HER2 enriched, basal simile. PAM50 measures the expression of 50 genes found in the tumor and then uses an additional 8 reference genes to provide Prosigna with a score called risk of recurrence, ROR. This simple and validated process is used in many laboratories today. It requires the tumor tissue to be isolated from paraffin blocks for proper RNA extraction. And then the hybridization process occurs without the need for genetic material amplification. The samples are then processed. The expression can be analyzed by the system after 2 to 3 hours. The final report is delivered 3 days after the sample has been processed. This report includes the risk of recurrence and the intrinsic molecular subtype. Regulatory agencies have approved Prosigna as a prognostic tool for early-stage breast cancer in the United States and Europe using the following 2 studies. First, the ABC-SG8 study, which averages a follow-up time of 11 years. The study uses groups of subclassifications from low, intermediate, and high risk, which allows the addition of prognostic information to be utilized beyond existing clinical and pathological criteria. Regardless of the presence or absence of lymph node involvement, Prosigna differentiates between the luminal A and luminal B subtypes to add relevant prognostic information. In the second study, Trans-ATAC, the median follow-up time is 10 years. During the study, Prosigna produced a higher recurrence score to provide prognostic information. Prosigna classified fewer patients as intermediate risk compared to the recurrence score. Prosigna is superior in predicting risk of distant recurrence of disease, so a follow-up is not needed for an additional 5 years. Trans-ATAC data shows the score of recurrence as the classic immunohistochemical panel loses the ability to discriminate the risk of recurrence after 5 years. Prosigna is the most robust platform in predicting the risk of distant recurrence in hormone reception-positive breast cancer.